Obsessive-compulsive disorder, OCD, is a chronic and often debilitating mental health condition characterized by persistent, unwanted thoughts, impulses, or images known as obsessions and repetitive behaviors or mental acts called compulsions. These obsessions and compulsions can significantly interfere with an individual's daily life, work, and social relationships. OCD is recognized as an anxiety disorder in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, highlighting its profound impact on emotional well-being and functioning. Symptoms and manifestations. The hallmark of OCD lies in the presence of both obsessions and compulsions, though individuals may experience one more prominently than the other. Obsessions are intrusive, distressing thoughts or urges that repeatedly enter the mind despite efforts to ignore or suppress them. Common obsessions include fears of contamination, fears of causing harm to oneself or others, excessive concern with order or symmetry, and unwanted aggressive, sexual, or blasphemous thoughts. These obsessions often trigger significant anxiety or distress. Compulsions, on the other hand, are repetitive behaviors or mental rituals performed in response to obsessions, aimed at reducing anxiety or preventing feared events. Examples include excessive hand-washing, checking locks or appliances, counting, repeating words or prayers, and arranging objects in a precise manner. While compulsions may temporarily relieve distress, the relief is usually short-lived, causing the obsessive-compulsive cycle to persist. In severe cases, compulsions can occupy several hours a day, drastically affecting an individual's ability to maintain employment, education, and social relationships. Causes and risk factors. The exact cause of OCD is not fully understood, but research suggests that it results from a combination of genetic, neurological, behavioral, cognitive, and environmental factors. Studies indicate that individuals with a family history of OCD or related disorders, such as anxiety or tic disorders, are at higher risk. Neurological research points to abnormalities in brain circuits involving the orbitofrontal cortex, anterior cingulate cortex, and striatum, which are implicated in regulating anxiety and habit formation. Neurotransmitters, particularly serotonin, are also thought to play a critical role in OCD. Dysregulation of serotonin pathways may contribute to the repetitive thoughts and behaviors characteristic of the disorder. Environmental factors, including stressful life events, trauma, or infections, may trigger or exacerbate symptoms in genetically susceptible individuals. For example, a subset of OCD in children, known as pediatric autoimmune neuropsychiatric disorders associated with streptococcal infections, PANDAS, can develop after streptococcal infections, suggesting an autoimmune component in some cases. Diagnosis and assessment. Diagnosis of OCD requires a thorough clinical evaluation by a qualified mental health professional. According to DSM-5 criteria, the individual must experience obsessions, compulsions, or both that are time-consuming, example take more than 1 hour per day, or cause significant distress or functional impairment. Assessment often includes detailed interviews, symptom questionnaires such as the Yale-Brown Obsessive-Compulsive Scale, YBOCS, and a review of the patient's psychiatric history. Clinicians also consider differential diagnoses, as OCD symptoms may overlap with other anxiety disorders, depression, tic disorders, or psychotic conditions. Treatment approaches. Effective treatment for OCD typically involves a combination of psychotherapy, medication, and sometimes lifestyle modifications. Cognitive behavioral therapy, CBT, particularly a specialized form known as exposure and response prevention, ERP, is considered the most effective psychotherapy. ERP involves gradual and repeated exposure to feared situations or thoughts while refraining from performing compulsions, helping patients learn to tolerate anxiety without resorting to ritualistic behavior. Pharmacotherapy commonly includes selective serotonin reuptake inhibitors, SSRIs, such as fluoxetine, sertraline, or fluvoxamine, which help regulate serotonin levels in the brain. Higher doses and longer treatment durations are often required for OCD compared to depression. In severe or treatment-resistant cases, other medications like clomipramine or augmentation strategies with antipsychotics may be used. Emerging treatments, including deep brain stimulation, DBS, and transcranial magnetic stimulation, TMS, are being explored for patients with refractory OCD. Impact on daily life and prognosis. OCD can severely affect personal, social, and occupational functioning. Individuals may avoid situations that trigger obsessions, experience strained relationships, or face difficulties maintaining jobs or academic performance. The chronic nature of OCD means that symptoms can persist over years, although early intervention and consistent treatment can significantly improve outcomes. While OCD is often a lifelong condition, many individuals achieve substantial symptom relief and improved quality of life through proper management. Conclusion. Obsessive-compulsive disorder is a complex mental health condition characterized by intrusive thoughts and repetitive behaviors. It stems from an interplay of genetic, neurological, and environmental factors and requires careful diagnosis and treatment. Although OCD can profoundly disrupt daily life, evidence-based interventions like CBT with ERP and pharmacotherapy offer effective strategies for managing symptoms and helping individuals regain control over their lives. Awareness, early detection, and supportive treatment are crucial in minimizing the impact of this challenging disorder.